we had already been monitoring the storm and watching, where it was going, where it was going to hit. We were pretty sure it was coming right to North Carolina, especially in our Wilmington clinic. After we got in on Monday, we said, okay, it's actually going to affect what looks to be the entire Visin area, especially our coastal and Durham, Fayetteville, and the Hampton area. So immediately you have to stand up your incident command teams at all the locations, all 7 of our sites throughout North Carolina and Southern Virginia immediately set up their incident command teams, and we started prepping from there.
Once the storm hits, a lot of people realize this is bigger than I thought it was going to be. How do I get my meds? How do I get my services? You guys have been stepping up and making sure that's there. Talk about that constant touching and outreach that you've been able to do.
Yeah, so that's very important. That we immediately knew that medication's the #1 concern for our patients. When veterans or patients or people are in a state of emergency, a lot of times they forget those little things like medication, or they may be waiting for their refill to come in and they haven't received it yet, and then obviously a storm happens and we can't get mail. So we had to immediately establish contingency plans for our veterans' medications. So 3 things that we did. On Tuesday, we started with Hampton because that was projected to be, they were in an evacuation zone. And so we immediately stood up a veterans disaster line. That's a national line that you can activate for the VA. The second thing we did was we stood up an employee disaster line, and then we were able to start the contract for Heritage Health, which means that in an emergency situation, a veteran can bring their prescription, as long as it's non-narcotic and it has an active refill on it, to a big box pharmacy like a Walmart or Publix or CVS or Walgreens. And so we said, okay, we're going to have these numbers out there. Let's start, because at that time it was only Tuesday, so the storm was it was moving very slow, still gearing up, which gave us the opportunity to really prep the public too, and our veterans and our employees about these main hotlines, because you don't really know what's going to happen when the storm actually hits. You don't know what electricity is going to go out. You don't know what number. You just don't know what's going to happen. So we had those ready to go and active. And to date, accumulation between employees and patient calls, we've seen around 700 to 800 calls. So, and a lot of them are those things like you said, medication. We had a veteran's wife call in. She felt like her husband needed hospice care. She was in dire need to get in touch with someone that could help her, and immediately our incident command teams are on 24/7. So they were able to connect and get that veteran into the hospice care. They may seem. There's a lot of little stories throughout the entire network, and once you read the call logs, that you're like, okay, you just feel we've done well here, and we're connected with our veterans on the ground.
Obviously, with the storm as big as it was, and knowing that it's going to affect things, you had to move patients around. Dialysis patients had to come inland where they could get services.
Right.
How do you make sure that the veterans that have moved out, where they evacuated, they can't come back home to their normal areas? How are they continuing to get the services they need when they're not at home? This is an odd situation. They might be out of even out of the Visin if they went to South Carolina.
Right.
How do you make sure that we continue to make the
Well, that's the unique thing about the VA, being the largest integrated healthcare system in the United States. We are a phone call away to our sister stations and our other hospitals and say, hey, we have your patient here. Here's what we're going to do with the patient. And until that patient can return to their normal healthcare system. A great example is just yesterday we had a patient that Jacksonville obviously had to evacuate. He evacuated one of the big in Winston-Salem at the big shelter there. Our amazing social workers from Durham were going through all the shelters. That's not even their catchment area, to say, do we have any of our Durham patients here, any veterans here, person to person to person, are you a veteran, are you a veteran, and saying, do you have your medication needs met, do you need to see a doctor, do you, can we schedule you a telehealth appointment, which means, you know, we have the iPhone here, we have the doctors, we have a clinical, today we have a clinical incident command team at Durham for veterans that we find in shelters or that are going to our mobile units. So that we were able to identify a veteran that needed immediate care. He was sent to the Salisbury ER, which is the closest ER for VA, not the Durham. And they were able to recognize, get him back to the shelter so he could take, because he wanted to take he wanted to go with his friends and family and go back to Jacksonville. Salisbury and Durham were able to contact the Fayetteville healthcare system and say, hey, we saw your patient. Can you please call him, you know, make sure he's doing well when he gets back to Jacksonville. Very integrated. The hotline has really been an amazing part of our emergency preparedness and actually execution. So you see these hotlines and you're able to track every single person, every single call that comes in. Even when you do have 100% accountability for your most vulnerable patients, there might be veterans that are not enrolled in the system that recognize that the VA can help them, and so they too will call and we will help them too. You asked me about the Hampton, evacuation of our patients, and we immediately knew that when we got the evacuation order, the mandatory evacuation order for Hampton, that our patients, if it were to hit there, were going to be in a serious situation. Our leadership, not only at our VISN, our regional office, but throughout the entire network in our sister stations, our partnering VISNs, we're all on board. Let's find the place for 217 patients. In less than 24 hours, we got more than half of them out safely to Richmond, Salem, Salisbury, Durham, and Martinsburg. That kind of thing is amazing when you watch it happen, to make sure that these patients are safe and they're taken care of. And then when it's safe for them to come back, then we obviously bring them back to their home station. So
a lot of our veterans are creatures of habit.
Mm-hmm.
They like to know where they're going ahead of time.
Yes, yeah.
How have the facilities held up after through the storm, and are there places that have changed because of the storm?
Yeah, that's a great question. So, well, I would say Durham is almost 100% operational. They have Morehead City that is, for example, today is going to get a safety assessment. You can see a little bit of water damage in the tile, and I actually did a site visit 2 days ago. But nothing with the normal eye could really see, except for little bits of water damage. But it's important to make sure that our safety people go in and check inside the walls and the carpets and the ceiling tile, and really get that thorough clearing for safety. So that clinic right now is not scheduled to start seeing patients yet as of today. That could change daily. So we've set up a mobile mobile command center outside in Havelock at the Walmart there, and it's pretty awesome. There's 3 exam rooms, telehealth. There's a vet center. There's a canteen to offer our veterans breakfast, lunch, and dinner if they're having a hard time finding food. We have nurses on site to figure out medication situations. Some of our patients do have to go to a different clinic to potentially get labs. So there's that coordinated effort was put there because we weren't sure where we were going to be in a week or so. As far as our coastal sites, I can send, we can post a list of the updates for those coastal sites, and we're hoping by next week we will have 100% of our clinics back up and running.
Excellent. Yeah. What else do you think that that people need to know?
Well, I think that it's when we get really we're all getting really busy when a hurricane is coming, or an earthquake, or a tornado, any kind of natural disaster. But what I think is important to know is something that's very different about the VA that does make us very unique is the behind the scenes, the tracking those very vulnerable patients, the very sick patients throughout the entire network. Dialysis patients you mentioned, we report on those patients every single day. They're very important to make sure they get the health care that they need. It's very important to track our homeless patients to make sure that they are getting food, water, recovery, medication. It's very important to track potentially our PTSD patients that might need a little bit more wraparound services during this time. So all of that really highlight, when you have a disaster such as this, it really highlights what the VA does as a whole system, not just one hospital, but as a whole system, how we're taking care of all those veterans. And for me, as a combat veteran myself, I want our patients to understand that, feel confident in their system that that's happening, especially in a time of emergency.
Obviously, with tragedies like this, it can make depression happen. It can
Sure.
when you lose everything, it can be rough on people. What is in place for those veterans that might need to just have someone to talk to right now to get through these rough times?
Yeah, that's a great question. And the disaster line, it will be activated the entire time until we're 100% operational, and then probably a little bit after that. And let me just walk you through, if I can, how that works. So a veteran calls that 1-800 number, and we can give you all the numbers, and you can put them on the website. A veteran calls that 1-800 number. The call center receives it. It's an actual person that's talking to the veteran, hearing what they have to say, figuring out their location, figuring out their main healthcare system that they're in, and going through all the variety of concerns that veteran may have. And some of those calls are very emotional. Some of our people have lost their homes, not only veterans, but our employees. And so those supportive, emotional support services have to be in place in order to really help that. Because if you don't have food and you don't have water, those are the basic necessities, then everything else doesn't matter. So we have to, as a system, still meet those basic needs and figure out locally where those resources are and connect our veterans to those resources, and also provide that mental health care and that the actual clinical care. So there's multiple aspects to a person's entire well-being. And so when that veteran calls and we receive that call, the hotline does, they give the services that's actually in that area. And then for any type of mental health concerns, especially if it's, and they feel it's a 911 concern, they don't tell the veteran to hang up. They do a warm, they do a warm handoff into those emergency services in that veteran's community. If that veteran is potentially suicidal, they do the same thing for the suicidal hotline, and then they call in to our incident command team and have our clinical staff handle that immediately. For our mobile units in Havelock, we have a vet center there. Just day before yesterday, being there, and one of the veterans I saw came in and his entire, he said he lost his entire backyard. He couldn't get his medication. He was in pain. That still is stressful for that, even though he didn't lose his entire house. But that, for him, that was stressful. For him, he was in pain. For him, that needs to be taken care of for him. So it doesn't, every veteran and their level of stress, or even every employee and their level of stress matters, and we have to figure out how we can assess that quickly and get them the services that they need. And there might be aftermath for a long time when it comes to, especially those coastal sites, that our employees and our veterans might need that emotional support. So it's always important for me to remind people that just because you go outside and the sun is shining and here, doesn't mean that that's maybe how other people are feeling in other areas, and we still need to remember them and provide them support.